And then here we have a visual to depict the importance of fiber for a healthy gut and gut microbiome and overall health. So on the left, a dietary pattern that is high in fiber fuels intestinal health, promoting gut bacteria, decreases inflammation, and increases overall microbiome diversity. So that's on the left with the higher higher fiber intake. And then on the right, conversely, we have low quality diets high in sugar and fat and low in fiber encourages the growth of bacteria that, number one, break down the protective intestinal barrier, two, promote inflammation, and then three, reduce health promoting microbial molecules. So this unbalanced fiber deprived state is linked to numerous chronic diseases such as obesity, type 2 diabetes, inflammatory bowel disease, and colon cancer. Okay, so here we have another research study, the habitual diet and avocado trial from the Journal of the American Heart Association. This was a large multi-site study, 1,008 participants with elevated waist circumference who either added a large avocado to their diets daily for 6 months or they followed their regular habitual diets. So persons or participants who ate avocado saw modest reduction in total cholesterol and LDL cholesterol just by adding the avocado. They didn't need to swap for any other foods or monitor their diet or increase exercise. This effect was exclusive to the added avocado. And so the question is, was fiber driving this effect? The authors of this study speculated that the fiber content could contribute to the improvements in total and LDL cholesterol. In addition, we want to point out that participants who consumed a daily avocado had improved diet quality, and despite the additional calories, daily avocado consumption did not impact the visceral fat, body weight, and fat in the liver compared to the control group who didn't consume avocados. And the Avocado Nutrition Center supported this study. Although the findings from one study cannot be generalized to larger populations, this study supports a growing body of evidence that suggests consuming heart-healthy avocados is associated with better diet quality. Okay, so here we continue to dissect the habitual diet and avocado trial with an ancillary study that evaluated the impact of daily avocado consumption for 6 months on gut microbiota in 230 adults. So this study was published in Food and Function in January of this year. Findings show that consuming 1 avocado per day for 6 months significantly increased gut microbiota diversity and beneficial bacteria, especially in participants with lower baseline diet quality compared to the control groups. And as we mentioned earlier, research on diet and gut health is still emerging. More research is needed, but the science that is in progress is exciting nonetheless. Also, this underscores the importance of enhancing counseling efforts to improve diet quality in individuals with poor dietary quality. Small changes such as adding a daily avocado can have a big impact. Okay, so here is another study. So this study was published in the Journal of Diabetes Mellitus and investigated whether avocado consumption is associated with the lower incidence of type 2 diabetes over a 6-year period among U.S. adults with Hispanic Latino ancestry. The study aimed to address the higher risk of type 2 diabetes in its population and to determine if avocado intake previously linked to better glycemic control could also reduce the risk of developing diabetes. So regular avocado consumption was found to be associated with 28% lower risk of developing diabetes, and then 31% lower risk of developing diabetes in those with a history of prediabetes. The Avocado Nutrition Center supported the research based on 2 24-hour dietary recalls. The results suggest avocados may have a role in blood sugar management and promoting a healthy lifestyle that reduces the risk of type 2 diabetes, but the findings are not causal and cannot be generalized to all populations.